The economic freedom fighters have been vocal about this project, saying in a statement that the party rejects the procurement of 100 scooters by the Eastern Cape Health Department. It even went as far as calling the scooters a baby pram. Joining me now to give us more insight is EFF Buffalo City Metro spokesperson Sia Rumbu. Sia, good evening and thank you for your time. In your statement dated 13th of June, you are calling this intervention a joke by the Department of Health, and you're requesting government to respect the dignity of a black child. The MEC, talking to us moments ago, says this is welcomed, in fact, by the poor of the poor in rural Eastern Cape, according to DMs that they have received, saying this is a well-welcomed intervention for people who otherwise would have been pushed around in wheelbarrows to access the healthcare system.
Good evening, Thabo, and good evening to the viewers. Thank you for having us. Of course, the MEC was going to say that because their main project in this province is to undermine the black child. Truth of the matter is that when the MEC was appointed to be the MEC and to be the head of health in the Eastern Cape, her thinking was that she was gonna be earning a salary for 5 years and going to be attending meetings. She had no idea that she would be challenged and pushed to this level. To be honest, the scooter project is actually undermining the dignity of our people, and I'm telling you today for free that if you were to go to these rural places that they are talking about, people are rejecting the scooters. We have been on the ground and engaging people, trying to find out what is their view on this scooter project, and they're all rejecting the scooter. And we suspect that someone with intentions of self-enrichment proposed this whole idea to the MEC, and she bought it, and we reject it as the Buffalo City, because we are the hotspot, and we have these rural areas where the normal ambulances can't reach our people. So we feel that they could have fixed the roads that we have and let the normal ambulances attend to the people.
Well, one would say the road infrastructure, of course, doesn't fall within the Department of Health. It's a completely different department that needs to be doing that. And the MEC saying, well, this is an immediate intervention that is required for emergency services that are required by patients in those villages where ambulances, as we're hearing, have broken down trying to access those places. And therefore, there is no other option for them at this point except for what this intervention will be bringing now.
Well, Thabo, when we first had the first lockdown on the 27th of March, we were told that the whole intention of the lockdown is to actually curb the infection rate, so as to allow the government to deal with the patients and all the infections and all those things. But now you can see that the government is caught off guard, and they are in 6 and 7 because they are not prepared. While they told us that they were actually preparing and they were slowing down the infection rate when they put us on this level 5, level 4, and level 3. So you can see that the whole project collapsed.
Have you been inside these devices, Sia, yourself, to inspect for yourself the comfort level and the facilities that are available on these devices?
You don't have to be inside the devices, Thabo. Just by looking at those things, you can see that they will not serve the purpose, because the whole purpose is to serve our people and to protect the dignity. When you are sick, you don't want people looking at you. Imagine an unfortunate case where a person dies en route to the hospital in full glare of everyone and everyone watching. So the dignity of our people is not protected, and you can see that the government has no intention of actually doing so even in future.
So there is a clarification that was given on that score, Sia, that says these are temporarily, well, primarily, shall I say, for transporting people to a nearby clinic or to a ambulance that would be on standby idling on a road nearby. These are not going to be used to transport patients actually to the hospital.
Thabo, you already have a problem of shortage of ambulances. Where do you think that they will actually dispatch an ambulance and dispatch a scooter at the same time? Where we already have a problem of ambulances being dispatched without the scooters. So do you really think that they will actually dispatch a scooter and dispatch an ambulance at the same time? It is just a way of trying to spin the whole thing, and we reject it.
So in your own view, you do not see a scooter being assigned to a clinic whereby when there is a need, then the scooter goes out and brings the patient to that clinic, or you completely reject the idea of an ambulance and a scooter being dispatched at the same time?
Our view is that they should have fixed the roads and used the ambulances that we have, and they could have procured more ambulances and more mobile clinics in ways of 4x4s or trucks, so as to assist the problem that we have in the Eastern Cape.
How do you feel about the view that this was procured locally and 200 jobs were created in the process, and it's not the billion rand that is being touted about, it's actually 10.1 million that was used?
Even if it was 100 rand, Thabo, the fact that the whole intention was not to help our people. The whole intention was to actually self-enrich, and I'll go as far as saying it was corruption. The fact that they were procured here or they were manufactured locally does not justify the fact that the whole intention was to actually self-enrich and not to help our people. So we reject it on those bases that these things were not procured to help our people. They were procured to actually enrich a certain few.
See, I appreciate